My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome back to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to be joined by CEO and founder of Meru Health, Kristian Ranta. Kristian, welcome to the podcast.
Hey, Norm. Thanks for having me. I appreciate it.
My pleasure. Well, it's good to have a friend on. Known you for many years now. But for all of our viewers and listeners that are less familiar with Kristian and Meru as I am, Meru Health is building a new standard of mental health care. So Meru was accepted to the prestigious Combinator Accelerator in 2018. Also operates nationally. Currently collaborating with Cigna, Aetna, Humana, Stanford University, Stanford Healthcare, and other health plans, as well as large employers. Kristian has been in healthcare for the past 15 years in the US, Europe, and Asia. In 2005, he founded his first company, Mendor, which developed a novel glucose monitor for type 1 diabetes. In 2014, Mendor was awarded with the Deloitte Rising Stars First Place Award in Finland. And in 2015, Mendor's glucose monitoring business was sold to a Korean public company, iSense. While Kristian was building Mendor, he lost his eldest brother, Peter, to suicide because of his depression. And that eventually led to founding Meru Health in 2016. So again, excited to have Kristian on and talk about his very mission-driven company, and talk all things healthcare. So Kristian, welcome to the podcast. I think I originally met you through the Hinge Health co-founders,
Yes.
which I believe you've worked with for many years. So walk me through what inspired you to get into healthcare initially.
Yeah, thanks, Norm. I appreciate it. So I'm originally from Finland, and I started my first healthcare business back in the days, the company Mendor, glucose monitoring. I basically, even before that, I used to work, while I was studying in the university, doing my undergrad and graduate studies, I used to work for a couple of years for this company called CRF Health, which is basically building software to help pharmaceutical companies do clinical trials better. So basically like digitizing clinical trial systems. And that was like an exciting journey. I worked there for a couple of years, reported to one of the founders there, and just got so excited about the intersection of technology and healthcare and the intersection of using cool things, technology to do good things. And that sort of like stuck with me. And I then left after 2 years. I hired the founder to be an investor, and then like join the board of my startup then. And then with my co-founders, we started a journey building a glucose monitor. And one of my co-founders then, he's a diabetic, and he's also an industrial designer. Mm-hmm. So that's kind of how we got that going. And it was definitely a steep learning curve. Like building a medical device startup straight out of school was not an easy feat, but it was a great journey. I learned so much, and eventually sold the business to Korea. And then after that, I founded Meru Health. As mentioned, unfortunately, I lost my brother Peter to suicide, and that kind of made me think through. I appreciate that. Yeah.
Horrible thing to have to go through, but with starting Meru, you made again a passion project, out of it, and it's very personal, which I think is very meaningful.
Yeah, I agree. It's been definitely a super meaningful journey so far. So.
Walk us through your experience in founding Mendor a little bit more, and then we'll, jump to all the amazing things you're doing at Meru.
Yeah, I appreciate it. So, I think, to be honest, I was just super naive back then. I was super eager, just straight out of school, and I didn't know anything about building companies and startups. Okay, I had been learning from, my previous company where I used to work for, the startup, which eventually became a unicorn. So they were growing fast, and I learned a ton. But that was still like a kind of just starting your own company, aged whatever I was, 20, 24, 25 back then, pretty early. So it was a journey. There's so many things I wish I knew back then. I think one thing that I've taken forward to, my current company and what I've built ever since has been basically the importance of culture and values. And values, especially in a sense that like you want to have people working together that share the same values and the same kinds of principles of how you work together. Because there's like with that company, we definitely had like great people in there, but we also had like all sorts of different interests and values and like, arrows crisscrossing in many ways, which eventually I think led to a lot of challenges which would have been avoided by just setting like a clear cultural spine and value-based spine for the company from the get-go, and then making sure that, that drives the culture forward, which is something which I've done since. But that was like one of the major learnings, I'd say. Like it was just a lot of heartache, to be honest, because we weren't fully aligned always, and we had some challenges, and we hired maybe some of the wrong people who didn't share the principles how we wanted to work, and we weren't just clear on these things.
Understood. I'm going to ask you a question that isn't easy to answer, but you grew up in Finland, then you encountered the US healthcare system. Walk me through like just the culture shock of like, wait, this is like actually how healthcare is done in this country, and just what were the surprising learnings you had, kind of transitioning from, I'm assuming Finland's healthcare system was the only one you knew growing up, to once you started expanding and starting these companies, you started getting exposure to how other countries did things.
Yeah, that's a good question. I mean, like, yeah, blessed having grown up in Finland in the universal healthcare system over there. It has its challenges though as well. Like it's not just only roses. There's like, access times can be really long, wait times can be long. Specialty healthcare, like if you need surgery or if you have cancer or like something like that, that system works extremely well. So, my family, as an example, have benefited tremendously, my mom and dad, from a really well-functioning specialty healthcare system. But then the basic primary care system, is actually not that great, to be honest. Like it's decent and it's of course available to everyone, which is important, but then a lot of people use private pay or corporate pay or paid primary care because it's just a lot faster. So there's kind of the healthcare system is like in like two layers basically. But when it comes to like cancer, diabetes, or anything like surgeries, anything like that, then most people use the public healthcare, and that works extremely well. And it's, like a night in a hospital in Finland is like, I don't know what it is today, but it's like $100 to $200 a night. And it's a top-notch, like world's best class.
Cheaper
hospital.
than staying in a hotel.
Yeah, it's crazy. And think about here, like it's just completely something different. But when I came to the US,
that was the joke my wife and I made when we had our kids. We're like, oh, this is the most expensive place we've ever spent a night in.
Yeah,
we've been in some really nice hotels and resorts over the years, but nothing held a candle to the per night average of having a kid.
But yeah, then when I came to the US, of course, like learning the ways here, I kind of moved here permanently in 2017. And then that kind of like taught me a lot. I'm still studying, still learning the healthcare system over here, but I think I've learned quite a bit since then. Knock on wood, I actually been very healthy, so I haven't needed to. I've only been to a doctor over the years, only one time. That was an ophthalmologist, so just an eye check. So basically, fingers crossed.
I'm glad you've had a clean bill of health these last bunch of years.
Yeah.
I'll ask you like how you maintain your health later in this episode, but let's jump into Meru. So walk us through, what it was like to participate in the Y Combinator accelerator. There have been some just tremendous companies that have gone through it. So walk us through like why you chose Y Combinator and, walk us through, that experience.
Yeah, so first of all, like when we came to the US and we wanted to build Meru Health in the US, we were, Finnish founders, and then we basically had no connections here. We didn't know anyone. So we basically had to build everything from scratch. And we saw that YC would be a way for us to like get credibility, get into the right networks, just like accelerate our journey and just, kind of give us a better chance of like really building the company over here. And we applied to YC actually 6 times. So we did not get in easily. We applied 6 times over 3 years. You could then apply like twice a year. Yeah. And we got in only on the 6th try. So that was first something that I always share with people. It's like,
That's a lesson for all of us, and especially something that's like one of the core values of my company and my team, but like I think digital health heavyweights as a brand in general, where it's tenacity and, really being determined and, not stopping after the first no is a key to success. Like I am a huge believer in the quickest way to fail is to give up. It's impossible to fail if you never give up, if you
yeah,
just keep trying.
yeah.
So, again, there's so many examples of some of the most successful people in the world that weren't successful immediately. How many people said no to Jeff Bezos when he started Amazon to
Yeah.
invest? Like hundreds. So just remember, just because like the first people you go to don't think it's a good idea, doesn't mean it's not a good idea. It just means you haven't met your right advisors or investors yet.
Yeah, I agree completely. And I mean, like, my mom always told me that I'm a stubborn kid, so I think that's how it shows in my adult years. So
I
tenacity is
think
important.
that's something people have called me over the years as well, and can't be everyone's cup of tea. But as long as you have some big fans and people that really enjoy your tenacity and just your ability to never give up, as long as you have your small tribe, that's all that matters.
I agree.
So walk us through just like what that experience was like once you got
Yeah,
in to Y Combinator.
totally. Totally. So yeah, we got in then 2018, and the accelerator is like a 3 month intensive like a work course. In a way, you like work 6 days a week
Are you in
for
the
3 months.
dorms? Like, what exactly is the living situation in those 3 months?
Yeah, you live at home. Like we had a hacker house in Burlingame in the Bay Area, and we kind of drive down. That was then Cooper. I think it was in Cupertino where they had the office back then. So we would kind of drive down every day when we had some sessions over there. It wasn't like you didn't have program like absolutely every day. So but there's maybe like I don't know 3 4 days a week. You'd have like some program at the campus. And then you'd work, like we used to work like 6 days a week and we had one day off every week. So like we'd take the Sunday off with the guys, go do a hike and grill and stuff like that. And then all the rest of the days we'd work like, dusk till dawn.
How
And
much were
then
you around other companies going through it? And how much was it like you guys just kind of bunkering down and like you and the co-founders just like going through the program, doing some of the coursework, probably doing some of the homework and tasks?
yeah, I mean, it was a lot of like founder dinners, a lot of like speakers coming in sessions, like a lot of office hours with our partners, the YC partners. So we actually got to meet a lot of the other founders, and we got to know a lot of the other founders. And I think that's one of the most important things actually of the YC experience,
Yeah.
to just get to know all these amazing people and be able to work with them and make like lifelong friends and stuff like that. So I think that's been one of the best things.
People always say like you are the average of your peer group. So if you join a very accomplished peer group, you're going to just elevate to the mean, just almost by osmosis. So I think that's great. Just out of curiosity, who was like the most like pinch me like speaker that came in where you're like, oh my God, there's like a celebrity, in the business world, that spoke during those Y Combinator courses?
I think Brian Chesky was probably like the most well known. So that was a good one. And then there's a bunch of other people as well there, some good folks. And of course, like all the YC partners, like many of them are also very seasoned people. So just learned a ton from them. Yeah, but it's like it's a great experience. It's a very intensive experience. It's very sort of like you need to be like super self-driven, meaning that like they won't like dictate anything. Like you need to like make the most out of it. But if you do, you can really get a lot of out of it. And I think we did. And then I think one of the things that I also wanted to tell about it is that the post YC experience has almost been almost even more important. And what I mean by that is that we kind of like once you're an alumni, there's like the network is just really, really massive and it's impressive. And there's a lot of founders, a lot of people, XYZ people who've been at companies and whatever they're doing nowadays, they're like everywhere in the society. And basically just wonderful people, and it has helped us so much to hire great people from the YC networks, just find partners, customers, connections, things like these. And then, of course, for us, one of the most important things was that we then were able to raise like a really nice Series Seed funding round. And that was one of the things that it was really hard for us to raise actually in the US before we got into YC, because we were just really like nobodies and we didn't have any of the connections and that, credibility. And once we kind of went through YC, things completely changed and we were off to the races. So it was very important.
What are the lessons you learned in that program that you think are still paying dividends today?
I think one thing is like some of these YC sayings that they kind of say very often. One thing is that there's like do things that don't scale. Like anytime you're building something new, like you don't need to like immediately automate things, but just like be scrappy and test things quickly. And a lot of these like startup principles, I think they taught these things and they really stuck with us. And then I think the other thing was like they always ask people and companies like what is one thing that you guys understand better than most of the other world or most of the other humanity. And that's something which stuck to me also, or stuck with me, that's really important. That's kind of guiding us even today. And for us, the answer was that we understand that mental health is not just mental, that actually physiological or physical health, a bunch of other things, inflammation, deficiencies, diet, exercise, sleep, other physical health related things. It's all connected, exactly. And that was something which we very thoroughly already understood when we went into YC. And then that's kind of carried us. That's what we're doing today. I mean, that's carried us all the way. So,
yeah, like I've talked about it at length on other episodes, but if you eat like crap, you're going to feel like crap and your mind is going to, going to go to dark places and, you're going to be more susceptible to outside forces, due to that. So whether it's, how you eat, exercise, sleep, like all of these things are like in tandem, part of your mental health, and it's not siloed, as some point solution vendors want you to believe. So walk us through how Meru works for the member and, how it's different from a lot of the other companies that say, hey, we do mental health.
Yeah, totally. So again, one thing, like kind of coming back from when I started the company, I realized through my brother's experiences that mental health as it is today, like medication and therapy, is not really effective for everyone. And I really dug deep into that question, like what's going on? Like why did my brother not get better? And what's going on with other people? Like was he just an anomaly or is there actually like other people like my brother? And when I really dug into the data myself, even before founding Meru Health, I actually realized that he's by no means an anomaly. Like there's so many other people who don't respond to psychiatric medication, who actually have horrible side effects and all sorts of bad outcomes from them. And also therapy. I mean, therapy can be very great and I've benefited from therapy myself tremendously. So I totally like pro therapy. But there's still a lot of people who don't benefit from therapy. And there's a lot of clinical mental illness that's not like therapy doesn't really work that well for. I mean, therapy is great for a lot of psychological stuff, and sometimes it does help with depression and anxiety, but there's also like just clinical mental illness that doesn't like get better from therapy. So those were the things that kind of guided the founding of Meru. And what we've built, what the company is today, we're basically and how we differentiate from others, we are more like a functional medicine approach to mental health care. So we've incorporated not only therapy like CBT, talk therapy, we've incorporated biofeedback. So we have a wearable HRV biofeedback, so deep breathing practices or like quote unquote quantified meditation. And then we have, of course, CBT, I think I mentioned. And then we have diet, we have sleep, and we have exercise recommendations. So we have much more kind of a broader look at like the lifestyle medicine pillars for individuals. And then we also have a peer support community. So we've kind of built that in. So we kind of wanted to build this much more of a holistic approach to mental health care. And early on, when we were building that, we of course knew that we have to do research because like it's just not exactly the standard. So we wanted to do research and we knew that we need to do research to get into the health insurance and so forth. And we started actually very early on with Stanford and UC Davis back in 2017 and then 2018. Doing clinical research, which we've since then extensively done. And when we're seeing like super strong results, so we're roughly ballpark seeing like 2x better clinical efficacy than in normal mental health care.
That's fantastic. So walk us through what HRV therapy is and how does Meru use it for it to benefit the patient?
Yeah, so one thing that I had realized through my own, I'm being a biohacker for a long time. So one thing I had learned from my own meditation practice is that there's clearly an impact. Like you can, through your breath, you can control your whole body, and you can control your mind and mood states. You can control your nervous system states by just through your breath and controlling your breath. So that's something which is, not self-evident, and it's not taught usually in our, in our medical system. But it's very much like a physiological, it's a real effect. And I had used a bunch of different, wearables that I still use, but I've been like throughout my life been using EEGs and just trying out all sorts of stuff. What I had learned through those experiences myself was that there's a very powerful, almost immediate impact when you learn to breathe at the right pace, to shifting your like brain signals, shifting your heart rate signals, your stress response. And I really wanted to make that experience, that tangible experience, available to all the patients who very often come to us where someone's told them that oh, you're going to be anxious for the rest of your life. You need to be on these drugs for the rest of your life. You can't really do anything about that. And we're like, that's complete BS. You definitely can do a lot about that. And you're not dependent on some external stuff like that. So I just felt that I really wanted to give people that empowerment that I had myself experienced, that actually you have so much power. You can control so much of what's going on in your life and in your body if you just start one step at a time, start training yourself in these skills.
Yeah, I find it very interesting that people will go get a personal trainer and pay out of pocket like it's nothing. And the same thing with career coaches. There are people that are like, oh yeah, my company doesn't cover it, but I 100% think it's a great investment for me to get career coaching or to get a life coach. But when it comes to mental health, people are like, oh yeah, I'm not going to pay for that. Or even seek out a way for my employer or my health plan to pay for it. They just kind of put it in a box. It's definitely, kind of putting it into a silo. And, some people feel oh, I don't want to admit I have an issue, or, there's a million reasons and excuses, people don't seek help. So kind of walk through how does Meru Health work with individuals and health plans and make it easy for people to opt in?
Yeah, totally. A good question. So first of all, we are in network for 60 million Americans and growing. So a lot of people may already be eligible through their health insurance. So when people find us through whatever channel, through the health insurance, through some of our advertising, whatever is going on, people can then kind of come to our site. They can schedule an intake call with their chosen provider. And that's going to be a master's level clinician. And then, in the intake call, it's a video Zoom call, kind of like this. And then, the person would then, there's a diagnostic interview, which is 35, maybe 45 minutes long, just getting to the root of what's going on, what are your needs, what are the clinical issues here. And then we also do a motivational interview. So it's not just about the clinical diagnosis. It's also what are your motives? What do you want to do? What do you want to improve in your life? And then we combine these two things into a custom care plan. That's then something that the person can work with us if the person so chooses. And then basically what happens after that is that you would work in an app environment, in our app, through video calls, through chat, and then kind of going through lessons and different practices like the biofeedback. We ship everyone a biofeedback wearable that they get to keep for life. And there's different things like weekly themes that are customized and recommended for different types of issues people have. There's certain basic skills we always teach, and then there's certain specialties we go into. It's kind of like it's a limited time, a time limited program that's 12 weeks for most people. And in that time, there's basically we kind of go through certain basic lessons and basic principles, and then just practice things and it's behavior change to a great extent. Everything in health actually is to a great extent behavior change. And that's kind of how we kind of get people through the journey. And they can do, work with the peer support group in the app. They have daily lessons. We have curated different content by best experts on sleep medicine or sleep hygiene or diet and mental health or exercise recommendations or just any CBT principles like how to stop worrying or what to do with my anxiety and things like these. So that's kind of how you go through this course with your dedicated therapist there for you every day, and video calls, chat, and full support.
That's fantastic. Are there any patient experiences that really touch your heart that you can share with us?
Yeah, a ton. We get a lot of feedback, a lot of testimonials from people, but we often get people saying that they, basically they were in a bad place and they completely came out of it. And what really warms me is that there's a lot of people who actually have tried a lot of other things, because that's kind of like, again, the story of my brother. And I see that more and more, that like people have been on like 5 different medications and they're still very depressed and they're not getting better. And then they find us somehow, and then they find, like, there's just recently someone posted this on like App Store or something, like that they completely reversed, like, I think she said like 40 years of depression, like nothing had helped until now. And now she was like finally free of depression. So these things are like, of course, like always make our day as a team here at Meru Health. But yeah, we're glad to be able to help.
Fantastic. How have you seen Gen Z, often called like the anxious generation, show up as members as opposed to some of these other generations in the patient populations?
We have like our typical patient is like a 30 to 40-year-old female or woman. And we have like, I don't remember like what exactly, like what's the percentage of like younger people that are, but we have like a decent amount of people also from like their 20s. But I think like, yeah, we're mostly focused on like sort of like the working age to, 30, 40, 50-year-olds.
Yeah. And why do you think society calls this the anxious generation? What do you think has occurred in just general life that causes like anxiety to be a more common thing than it was in the past? Do you think it was just not diagnosed as often, or do you think like life is just not as simple and easy as it was 50 to 80 years ago?
Yeah, it's a great question. I think actually, I don't think it's that life wasn't easy. I mean, like life definitely wasn't easy like back in the days when I listened to my grandparents or my mom and dad. Like, I mean, in many ways, life seems to be easier these days, but there's different kinds of challenges. I mean, like the whole climate, the whole global situation is kind of unsettling for a lot of people. And I think there's few different things that have changed in the recent years or the last decades. I think there's continuously increasing amount of environmental toxins in our foods and in our environments. And these toxins, pesticides, heavy metals, other things are really causing people a lot of issues. And they are like still not well recognized by most of the healthcare system, but I'm absolutely convinced that they are behind a lot of these challenges that people are facing these days. And there's, there's recently more and more movement to kind of start tackling these things. I mean, I think that's very, very important. Like Brian Johnson, as an example, I don't know if you followed him, but
I've seen the Netflix documentary. It's very interesting.
Yeah, he's doing a lot of good work also now, looking at like lab testing all the foods and then like kind of really like explaining to people how much crap we have in our foods, which is like really unsettling. But nevertheless, I think that's one thing that has changed. There's like an increasing amount of challenging chemicals in people's environments that are causing all sorts of not just mental health issues, but all sorts of other issues. And then I think the other thing is just like the pace of life, like think about the TikToks and the Instagrams. Like life has become like so frantic for a lot of people, and all the news coming in all the time. Like you're following all the news and you're like in all this social media all the time. Like it's just like the pace is probably like too much for a lot of people. It just causes anxiety even more, or exaggerates anxiety in a lot of people.
Yeah, and I think it's not just social media by itself. I think it's technology and how it has pretty much given people zero privacy at any point, right? Like back in our parents' generation, they would go to school and, see their friends, and then they'd go home and like without a telephone, like they had no way of reaching you.
Yeah.
Now it's like your friends, your family, your coworkers can like reach out to you at any time of day,
Yeah.
morning till night, and you're constantly getting pinged. Sometimes they're very good things, but sometimes they're not good things, and sometimes they're stressful things. So like our parents used to be able to go to work in the morning,
Yeah.
they'd leave, and then they'd like kind of shut off, and like they couldn't do their work. They couldn't know what else was going on. Like my dad like was a lawyer, and he used to say like, yeah, like back when I was a lawyer, you'd get your work done and then you'd send mail out, and like it would be days until you got contract proposals back or responses from people. Now it's instantaneous. It's in an email, it's in a text. And it's like, well, did you read this?
Yeah,
I sent it 10 minutes ago. Well, yeah, like I expect to like a prompt response. And that's everything in life, right? Like back in my business, like you used to send resumes like via mail. You used to call people and then like okay, like send me your resume via this address. And again, like now the business is very different, but there's a lot of demands, from the candidate pool, from the client pool. So like no matter where you go, I'm sure you as a CEO get constantly pinged by all types of different people, and like you never technically can turn it off. And there's this culture within, the business world that, you got to be available and you got to be prompt and you got to be professional. Some of the most respected people, that I know in business are like, yeah, like I'm pretty much available 24/7. Maybe I turn off my phone on like a Saturday or Sunday, but there's almost this like badge of pride where it's like, hey, like I'm available 24/7 and like this is important to me. But it gets to a point where it does become overbearing for most, and there's no escaping. And I think that's a dynamic that is often overlooked.
No, I 100% agree with you. I think that's absolutely part of it. And actually, to be honest, like I've been personally like setting quite a lot of boundaries. Like I don't check stuff on weekends nowadays.
Yep.
And I try to really I do some prep work on Sunday evening before the next week. But other than that, I don't work on the weekends because it's just like you gotta like find balance. Otherwise, you're gonna like just get cooked. Like things get too crazy, and it's also like I've always had this mindset that it's better to like when you do work, like do it really well and focused, and then when you do like sports or do something else, do something else.
Yeah, and like I got hit with reality pretty quickly, where now that my daughter's 3.5 and she can talk, she literally at home, if I'm on my phone, she's like, Daddy, stop working on your phone.
Yeah.
And like, it's always just, it's just another email. It's just, this is like a client. I need to text them back.
Yeah.
But like your kids realize like, wait, am I the priority? Or is like whatever's on that phone the priority?
Yeah.
And you really have to look yourself in the mirror and be like, what kind of parent do I want to be? What kind of example do I want to set? So I've definitely, over the last 6-8 months, my wife has told me like, hey, you're doing a lot better with this, is when I'm home and with my kids and with my wife, like I'm super present. And like once they're asleep, like the email sent to you at 6 o'clock can be answered by 8:30. Like it doesn't need an immediate response. And I just, I'm trying to train myself to, be present, because I don't want my kids to remember me as this.
Yeah.
I want them like knowing like, hey, you're the most important thing in my life, and you are a priority. And, I want them to feel that. So I think another thing that Meru does that not all mental health vendors do is offer a peer-to-peer support option. Can you walk us through like why you felt that functionality was crucial and why you believe, that allows Meru to get some better results than some vendors that don't?
Yeah. So I think one thing I realized early on when I was going through like my family experience with my brother and then like just studying all the mental health interventions, one thing I realized that there's actually there's first of all great evidence on peer support, like it works really well. And there's also this huge bias, especially with people with depression. Very often they think that they're isolated, that they're the only one who's feeling like this, that I'm like abandoned by the world, like no one can really understand me. And it's a real feeling in those moments for many of those people. But then when you see that like actually, hey, there's, when you talk to a peer, when you realize that, hey, you're not alone, like there's many other people like your type of people that actually have these same issues, and it doesn't make you a bad person. Like that acceptance and that that just helps a lot of people. So that's why we built the peer support group and functionality for people to be able to share learnings and to be able to see that they're not alone and they're not struggling alone. And it's totally okay. Like it's acceptable. You don't need to be ashamed of it.
100%. And I'll tell you this, just to humanize it, in the last 2 years, like I had to take some time off and, focus on my mental health. And it was a weird situation because it was before my son was born, but after my daughter was born. So I had one kid at the time. And, I loved her. I loved my wife. My career was going better than it ever had. But at the same time, I probably never was under more stress because big expectations at home, lack of sleep, no time to work out, no time to cook healthy. So like all the things we talked about, right? Like I started neglecting and I said, well, if it's not work or family, I don't have time for it. which just created just immense pressure. At least I felt that pressure.
Yeah.
So I had to make a tough decision, maybe a couple of years ago where I said, you know what, like I need to detach. Like I need to trust my team and take a week and a half off. And in that week and a half, when my, daughter was at daycare, I worked out probably like 3 hours a day, not like intensely, like maybe I'd do a little bit of lifting or like a Peloton ride, but like I remember it was like spring, summertime. So I was able to like walk around the block and go to the park like a lot. And like I would even do like phone calls, walking, but I was like really active, way more active than I usually was.
Yeah.
I was eating really healthy, no takeout, no processed foods, like all plant-based, whole food diet. And I made sure I was sleeping at least 8 hours a night. And within a week, I felt a lot better.
Yeah.
And I realized I'm like, hey, like you can't burn the candle at both ends.
Yeah.
You can't just neglect everything and like only focus on a couple things. And I realized like, hey, by like spending a half hour to an hour a day, like exercising, to take the 30, 40 minutes a day to cook like fresh, healthy meals, to be able to maybe work a little less, but get a full night's rest and like sleep makes me better in those hours. And I wasn't as obsessed with like, oh, I gotta like get everything done and I have to like have zero, emails that are unread like before I go to bed. And I just started to prioritize things and, start delegating things. And I got to a balance where, yes, I still feel I work harder than 99.9% of people, but at the same time, it's not overbearing. And when I'm with my kids, I don't feel like, oh, guilty that I'm not doing work.
Yeah.
When I'm doing, other things, I'm not like, oh, I should be working right now. So again, I was really intentional. I had the ability and flexibility to kind of just like take a pause and really refocus on some things that were important. And I luckily, snapped out of it. It's always a struggle, stress and anxiety.
True.
But if you just kind of push it down and don't address it, it can turn into, full on depression and like a feeling of helplessness. And I've been there personally. So, you decided as CEO that unlimited therapist chat support was like a crucial feature. How has the market reacted? How have patients reacted to unlimited support?
Yeah, well, I mean, like even before that, I just want to like kudos to you, Norm. I think thanks for sharing. I appreciate that a lot. Thanks for sharing your story on that as well. It's
my pleasure.
But yeah, how did we do that? So I mean, like we basically figured that since we do video calls and chat, but we actually are much more geared towards like bi-daily touch points or even daily touch points with our provider and with the patient or with the participant. We kind of felt and saw that like the chat component, when it's delivered in a way that's like available, like very, very quickly and easily accessible, can become a major component of the whole care continuum. And so it has. And over the years, we kind of ended up in a place where we decided to make it fully unlimited because we realized that not everyone is using it. Like there's like a bell curve, like some people use not that much, some people use a lot, but over time we like learned what the average was and we were able to like just tell people like, hey, actually you can do as much as you like. And that created even more trust for people to see that like, okay, I can like, this is kind of a different way of receiving care because it's not just video calls. And people were sometimes also hesitant, like, can I try this? Or I want to do video calls, but then that's kind of like convinced more people to like give it a try. And then always when we get people to give it a try, they're like, oh wow, I actually love this because now in between the video calls, now I can actually also like work on things and I'm held accountable, but I'm also like supported. So again, that kind of all even further comes from the challenges that my brother faced where, in between appointments, no one was there. Like there's no one there for him. Like the current healthcare system and the current mental health system to a great extent is just available when the appointments happen. And if they're like 2 weeks out or a month out, no one's there. And I kind of like really wanted to like rethink that system. I just didn't think that doesn't serve people in the modern world anymore. And it's better to be like, if you're really in the worst weeks of your life, like bouts of your depression or something like that, like I think it was kind of self-evident idea to some extent for us, at least our team, that like, hey, let's make care available during those weeks intensely, so that like people can get better, and then that they don't spiral to an ER or they don't spiral to a suicide. So that's kind of like why we built it this way.
And how does Meru qualify your therapist to make sure, the therapist is the best fit for individual patients?
Yeah, so first of all, like when we hire a therapist, we have like a rigorous process of screening and several interviews per therapist before we hire them into our network. But then when when someone is looking for a therapist, they basically can choose based on different criteria, and then they can always switch if they don't feel connected with the therapist. But since our offering is not just about video calls, we've actually learned an interesting dynamic that way less than in a traditional teletherapy, in our case, people don't want to change therapists that often, because our offering is not just about that video call. It's so much about the lessons, so much about the peer support, like the biofeedback, like the chatting with your provider. And that actually, the whole experience is very different from just televideo calls. And therefore, different things become important. And we've kind of learned that this model also does not drive as much like people wanting to change their therapist anymore. So it's kind of also a really interesting dynamic we've learned.
Yep. What traits do you look for when hiring at Meru? Not only therapists, but like on the business side as well.
Yeah, well, we first of all like extensively screen against our values. So, some of them are like, without going through the whole list, is like integrity, very important. Actually, compassion is one of our values. So we want to really like be a tight-knit team and support each other, not just grind.
That's extremely evident in knowing your team for several years now.
Yeah. And then we also look at like different traits like resourcefulness, and like team first is one of our important philosophies. Like we really work here as teams, and it's not about the individual, it's about how the team performs, how the whole company performs together. So we look at those traits as an example, and we extensively screen people for those traits. And then, on the professional side, on the skills side, we always have like an assignment for everyone who, for every role. We always set an assignment, like design some sort of like an assignment for the candidates that's very relevant for the tasks at hand, where we then evaluate also like just, work performance as one part of the interview.
Yeah. So your company achieves 89% of participants who significantly improve clinically, and 59% experience full remission from symptoms of depression and anxiety after completing your program. We've already talked about why your solution's different, but like any other explanations for getting these just insane results?
Yeah, there's two main components. I think we've kind of touched upon them, but to summarize, the first thing is that this continuous engagement, so this kind of continuous remote care, is actually engaging people way more, and people spend way more time on the Meru platform than they would spend in normal telehealth. So we have just like a lot of engagement in a shorter amount of time, in like a shorter period of time. So that's driving like learning, behavior change, just like internalizing these new things. That's one thing. The other important thing is that we're not just about CBT. We touch upon exercise, sleep, diet, deficiencies, these things that are like really, really important actually for your whole body to function. And like as an example, B12 deficiency as such can cause or be a major cause of clinical depression. And there's no way you can talk yourself out of a B12 deficiency. Mm-hmm. So you got to address that. Or like vitamin D deficiency is another thing that can be very detrimental. And a lot of people are actually definitely very deficient in vitamin D as an example. So these things are just adding to the whole mix of better clinical efficacy, because more people with various different issues can be addressed by this model than just by the traditional model.
Yep. And you can get vitamin D from being outside. So yes, get outside. If Kristian's background gives you any inspiration, it's good for your health and quite beautiful and relaxing. So what's next for mental health? AI is like all the rage right now. Like, how do you see the mental health market evolving over the next decade?
Yeah, I've been thinking about that a lot. I think there's two things at least that I'm seeing. First of all, like AI, of course, it's massive. It's going to be driving a lot of efficiency. It's going to be driving a lot of better access. It's going to be driving, even already now what's happening is that a lot of people who don't have access to therapy, they can use different language models or chat kind of AI bots to address some of their concerns. And then I think it's eventually going to be more and more common. But then again, also, AI is going to be helping to streamline workflows, but we are also using AI in many places in the company, which is already helping a lot to just like streamline different things and make our processes better, supercharge our providers even more. So I think those are like things that are just going to be amplified going forward. I think the other thing that's coming that I'm a strong believer in is that more of this kind of functional health, holistic health is going to be increasing. Like there's going to be more of an kind of marriage between the physical and the mental health in the future, and I think that's like really really positive. And I think that's going to be in the next 10 years. It's going to be a dramatic shift towards more like psychiatry is going to change a lot. Like, psychiatry has been like so niche and narrow for a long time, and it's definitely going to be changing a lot.
Yeah, couldn't agree more. And, again, I want to really thank you and your co-founders for allowing your members to have unlimited therapy because in healthcare, at least in the US, from my unique perspective, the way to make profit in healthcare is to limit access. That's what the health plans have tried to do, to be able to allow them to earn record-breaking profits year after year after year. And the patients are the ones that suffer. So again, it's just really, really nice to see, again, a for-profit business that hopefully makes a huge exit at some point, but they do it by doing good, not by, gaming the system to make it profitable for the company. They're doing the best thing they can for the patients and, hoping that is the winning business strategy, which I really, really love. So you've built two successful healthcare companies, now. What are three crucial traits that you think founders need to have to be really successful in this very unique market?
Wow, yeah, that's a good question. I mean, at least for me, what's been very important. Don't know how much this applies to other people, but at least like tenacity, as we talked about already, like you just really can't give up. Like you gotta be relentless in learning and figuring things out. You just need to like go ways to kind of just really find the answers, learn things, how things work, understand things thoroughly. I think that's one thing, that drive. And then I think the other thing, at least for me, being very mission driven in healthcare has always given me an edge because I truly care and I truly I can really stand behind my mission and my work. So that gives me, at least I like to see that it gives me some extra powers and alignment. And I think third is just your team, your people, like kind of my co-founders, my team, like I'm nothing without them. Like it's like building a great team, being stronger together, building good things with great people. I think that's kind of my motto. So yeah, those things I would say that like are very important.
Excellent. So I asked a little earlier, and we'll definitely ask directly now. We got to practice what we preach, right? Like we can be in the healthcare industry, but if we don't live it, breathe it, sleep it, we're hypocrites. So how do you go to the doctor one time in a decade? How do you reduce stress, and how do you exercise to help keep yourself healthy in a very stressful job?
Yeah, well, I mean, like I've had my routines for quite some time now, but like one thing where I started from pretty much was meditation. So like a daily habit of some meditation. I usually try to do it, for 10 to 20 minutes a day. I'm not always successful. It doesn't happen every single day, but let's say like 300
Do you have
days.
an app you use, or
I used to. I used to use an app, but nowadays I don't even use an app. I'm just doing it. Like it's become such a deep-rooted habit.
Yep.
But I used like Headspace and I used some other apps in the beginning as well. But that's one thing. Like this is like kind of helps me focus, helps me be centered, helps me recharge. And then every day I exercise. I do some exercise every day, like 6 days a week, some like rigorous exercise, and then at least like a good walk on the seventh day. So some exercise every day, 7.5 to 8 hours sleep. Like that's what I really like stick to. I really want to make sure that I get enough sleep because like you said also, I've learned that if I start compromising on my sleep, like, not immediately, but after a while, it starts to really like hitting me. And then my diet, like very, very so like, deliberate about that. I mean, I'm now actually in the last week, I've been on a completely vegetables, plants and fruits and berries.
How
So
long?
in the last week, 8-9 days now.
How do you feel?
I feel so good. I mean, like super energetic, like just so good. And I sometimes do these cleanses where I just do like a week or two, just berries, roots, vegetables, and fruits. And it's like,
That include like tofu and meat replacements?
no, nothing
Whole
like that.
foods.
Just completely whole foods, berries, vegetables, root vegetables, or fruits, and nothing else. And I feel so good. So
But
good.
that includes like legumes, lentils, and like edamame. Like I'm just wondering, because like I eat
Yeah.
plant-based and like I need something to keep me full.
Yeah, I mean, like this is more like a temporary diet. I
Yep,
don't eat like this whole year round, but
for
this is
sure.
more like a kind of a diet for just to reset things. But when I do this, I actually don't even do any legumes.
Oh,
I
really?
just like stick to a lot of fruits, a lot of berries, and I'm a little bit hungry every once in a while, but it's it's like a finite period. I don't like do this all the time, but it's like after this period, like let's say once a quarter, I feel so good.
Good, 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 good. Well, again, Christian, thank you so much for joining us on the podcast. Definitely, one of my most favorite and engaging episodes. And again, keep doing what you're doing at Meru. Big fans of what you're doing. And I know 60 million Americans have access to your services now, but hoping over 300 million pretty soon. So
Hope so. Thanks so much,
appreciate it.
Norm.
Thank you. Really enjoyed it. And thank you for what you're doing.
Thank you, Norm. Appreciate it.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.